is your esophageal rupture? From the history, the patient will usually present with a chest pain that started after vomiting or retching. You can have two types, which is the spontaneous. These are usually caused by Burhoff syndrome or deceleration injuries. Or you can have penetrating trauma to the neck, stab neck, chest, gunshot wounds. They can all cause esophageal ruptures. These patients typically present with subcutaneous emphysema, and it can be quite widespread. They can also present with retrosternal or pleuritic chest pain if they've had the esophageal rupture for more than usually 24 hours. These patients can present with fever, sepsis. They also tend to have dysphagia, adenophagia, hoarseness, and if it was trauma to the neck, they can have cervical tenderness. Special investigations that you'll do is when you do a plain chest x-ray. It is quite difficult to visualize, but you can see that there is free air running just next to the mediastinum. But when you do a contrast esophageogram, you can actually nicely see the esophageal rupture. Other special investigations that you would do, ECG is not usually diagnostic. CT you only use when you cannot diagnose the esophageal rupture by any other means. What you will see on CT is basically what you see on the esophageogram, contrast esophageogram with x-rays, and this would be a wall discontinuity. You can have contrast extravasation. You can have a pneumomediastinum with esophageal thickening if it's been long-standing, and you can have mediastinal fluid collection. Management of esophageal rupture, your aim is to repair within the first 12 hours of rupture. So when the patient presents, you need to stabilize if the patient is unstable on your ABCDEs, and then you need to call the surgeons urgently because they need to perform a primary repair and drain the fluid. If it's been more than 12 hours since the rupture, a primary closure is discouraged due to the infective nature of esophageal ruptures. They need to do a generous drainage, drain out all the fluid, especially if it has formed an empyema. You also need to do a diversion of the esophagus, and you need to do aggressive antibiotic treatment in these patients. These patients, if it's been more than 12 hours, tend to not do great. So urgent surgical referral, urgently get your surgeon on board is important for these patients.